Amwa Cancer Foundation was inaugurated last year. The mission of the foundation is to provide cancer education in the community, more especially among the minority communities who are underserved with the existing services. We go to churches free of charge to educate people. We travel over the place to educate people. Our goal is to try to reduce cancer death in America, because the earlier screening will prevent cancer. It could be treated when one is screened early. It could be treated easily. And also, people who are 50 years old, try to talk to your doctor so that you can get screening. If you're a black person, it should be 45. Then the doctor can then see you or recommend you for a colonoscopy. That's the only way you can save your life. That's it.
She just wants to buy herself. She will do something bad. Take her. That's what Hello, my name is Sterling. My name is Uncle Zach. We're here with Visalis, the Body by Mind 90-Day Challenge. Whether you want to lose weight, gain muscle, or simply get great nutrition, you can reach out to us. Our number is 401-484-8777. This is a great program just for you to be able to get healthy. We all know that most diseases come from the food that we're putting in our body and from the weight that we carry. So if you're looking to make that change and challenge yourself, please get with us. Thank you.
It's hard to have those kinds of concept of bridging because it's so tight now. It's a little.
I can be cold.
Good morning, everybody. Thank you. That's good. That's really good. Please, those sitting in the back, you move forward. A lot of people are still coming in. I want to welcome you again to our 7th annual African Health Summit. Those of you who are coming back this year, we really appreciate your presence and your participation. Those of you who are new, please feel free to ask questions. How we've done in the past, and so you'll be able to come back next year. Just a couple of administrative things. There are 2 bathrooms. One is directly behind you. The second one is directly below it in the basement. And everybody will keep through that same door. So I'd like to start by expressing on behalf of the African Alliance, expressing our gratitude to our sponsors. And I say sponsors, they come to us in different categories. So I'm going to mention a couple of them. hope I remember everyone. I start with Sodexo. Sodexo has stepped forward again. Every year they do this, but this year they step forward in a big way. We really appreciate their contribution to make this event a success. Talking about Sodexo, there is another person in there I think I need to recognize, and that is Jorge Cardenas. The guy has so much energy, I don't know what to do with it. just too much energy. The second sponsor that I think I should express our thanks to the Department of Health. If I start to talk about the Department of Health, what they have done for us, for this community, to be here for about an hour. So I will just keep it as brief as possible and say thank you to the Department of Health, and we look forward to continued support from them. The third is lifespan. And please allow me to say one or two things about what Lifespan has done for us. Over there in the corner, you will get to look at it in a few minutes. They donated 4 baskets. Not just a basket. Those of you like to eat yam, or if you like to eat any of the African food, no, I won't give all the secrets away. You have to stop by there and check. So we're really grateful to Lifespan. ARP, and I'm sure Neighborhood Health Plan, staff, material, a lot of hours, and Mike, we're really grateful to you for your time. And last but not least, if I forget, I will come back and recognize them. Is Blue Cross Blue Shield. They've been coming to this event every year for so long. So we're really grateful. Actually, what I think I should do is leave the rest for our Master of Ceremony in case I forget any of them. The next group I think I need to express our thank you is the committee, the planning committee. They work very hard. And a special thanks goes to Sandra. Sandra is somewhere in the audience. She put in a lot of hours, a lot of hours. And congratulations to her. Also, she just bought a new car. There are many of the board of directors of African Alliance here. Some are still coming up. If you are here, member of the board of directors, please just raise your hand. Okay, we have the rest coming in. I know you don't want to listen to me for the rest of the day. Please take a look at the content of your folder. You've got a lot of material in there, and we will be telling you a little more about it as we move forward. So, let me bring to you a member of the board of directors of the African Alliance to introduce our MC, Jim Vincent, please.
Good morning. How's everybody doing? I'd like to thank each and every one of you for participating. This is going to be a great day, but we have a great MC. She's a great friend of mine. Great friend to the Rhode Island community. Gertrude F. Jones is a dynamic speaker and innovative leader, recognized and celebrated as a businesswoman and a community champion. She has been responsible for financial operations, diversity initiatives, community organizations, business development, and marketing for many different organizations. She is currently the Vice President of Community Relations for Lifespan, Rhode Island's top health system, comprised of 4 hospitals. For the past 6 years, she has served as Director of Diversity, helping to establish Lifespan as a recognized leader in the region with respect to diversity and inclusion initiatives. She is a former Deputy Director of the Urban League of Rhode Island. She's a former member of the Providence School Committee. She spent 6 years there, the last 3 as the President of the Providence School Committee. She currently serves as the president of the National Coalition of 100 Black Women the Rhode Island chapter. Gertrude received her BS degree in Business Management from Johnson Wales University. She currently resides in Rhode Island with her husband and is a proud mother of 3 daughters. Let's give her a nice warm welcome applause. Gertrude Jones, our MC today.
Good morning, everybody.
Good morning.
Good morning. I'm just getting closer to the laptop so I can cheat. Well, this is certainly exciting to be here and to be able to kick off another one of these fabulous health programs. And I am honored that the very first African Alliance Health Summit actually happened at Lifespan about 7 years ago. And I didn't remember that until Julius reminded me of that when we did a health summit on the condition of malaria, which is an incredible disease, right, that is wreaking havoc in many of our sub-Saharan minority communities. And that was an incredible event, right, and it was an opportunity for Lifespan to do some really advocacy work, right, on a very important issue, given some of the work, right, that we do in our immunology clinic. So it's almost like full right circle, like 7 years. You know how they say that in bankruptcy they forgive your debt right after 7 years. So I feel like we're like actually coming full right circle in hosting, being asked to be the MC for this event. And I want to point again back to the baskets. So make sure you come up and take a good right peek at the baskets and what folks will be raffling off later on. And you can get your tickets, I think, right at the registration desk. Everybody's waving at me. See those beautiful ladies right back there waving? Please be sure to buy a ticket because it will benefit malaria again. So Julius really didn't say who he was really. Those of you who know Julius, he's a very humble man, right? He doesn't like to be out front, but Julius has been around for a very long time. I met Julius when I was on the school board about 10 years ago, and I worked a little bit closer with Julius when I was at the Urban League of Rhode Island. I heard about him, and then he ended up calling me, and we went to, I think, either the breakfast and dinner, and I said to myself that this is a real person who has a passionate heart for the community. Not only for the African community, which is his first love, of course, because of who he is, but for all communities. Hence, I think, why I see such a diversity in the audience today. So let me tell you a little bit about who Julius is. He is Nigerian, from Nigeria. He came to the United States in 1971, right? And he didn't want me to say that so you couldn't figure out how old he was. So I won't say how old he was when he came here from Nigeria. He spent 21 years at the former, now it's called National Grid, but the former Narragansett Electric Company, and retired 3 years ago, Julius, 4 years ago? 3 years ago. And he serves in many capacities, but the one why we're here today is due to his presidency of the African Alliance. He is a co-founder, so he founded the organization that has resulted in this 7th year doing this healthcare summit. He was the president of Oasis and was the person establishing the first black-owned credit union in the state of Rhode Island, and there hasn't been one since then. And I keep on telling Julius, you need to open it back up again, Julius. He said, yeah, Gertrude, in my spare time, right? He also serves on the Rhode Island Food Policy Council. He tutors in his spare time at Dawkins Place. He's a trustee of the Providence Library, the Providence Redevelopment Agency, on and on and on and on. So I'm honored that Julius thought that I had enough in me to be the MC for this program today. So here we are. So how will it flow today? We have have two fabulous folks right here who are going to give you some education today. Mike Gray, who I'll tell you about a little bit, and then after Mike Gray comes up and speaks, and then we'll have Linda Cass. Where's Linda? Okay, hi Linda. Hi. Linda Cass, from the Economic Progress Institute. She will talk about healthcare reform. And then after each one of those speakers presents, we'll have Q&A immediately following. So as they're speaking, I think of some questions that you'd like to ask them, because after you're done, I like to do some quick moderating to handle your questions and to give them to the speaker. And then same thing for Linda. After Linda presents on her topic, then I'll do some Q&A for hers, and then we will have a break, and then we'll go into our workshops. We have 4 fabulous workshops that I'm going to tell you about a little later on. After the workshops, we will come back, and then we'll have lunch. Okay, does that make sense? Sounds like a plan? Yeah. That's the plan for today, right? Feel free to stop me if I'm going too fast right in, but ask me questions. But again, I encourage you to come up and get some raffle tickets, and because it's going for a very good cause. So, Mike Gray, and that's Mike Gray with an E, not an A. So who is Mike? Mike is a friend of Jorge's from Sodexo. Mike joined Sodexo in 1991, working with school districts in Northeast. He has held food service manager, area manager, safety coordinator. Can you hear me? Yeah. Good. Okay, good. General manager, general manager, training manager, district manager. This is a trained manager for Sodexo, and he is now vice president. He heads up the operations for Sodexo School Service Program in New England, including New York, New Jersey, Pennsylvania, Michigan, Indiana, and Ohio. So Mike is on the road a lot. And he has a passion for healthy diets and for children and attention to special diets and allergies. So he's a wonderful speaker for us today. In 2008, he served as chairman of the African American Leadership Forum, a network group for the Vision Group at Sodexo. He has had a mission of inspiring leaders. Lincoln Chafee, the former Rhode Island Governor's Workforce Board, is appointed here by him. He has a bachelor's degree from the University of Mass at Amherst. He is or serves with the School Nutrition Association, lives in Rhode Island, married, and 2 kids. So he has a wealth of knowledge about food and nutrition based on his work on working with school districts, families, and children. So I'd like to introduce our first speaker, Mr. Mike Gray.
Morning, everybody. Good morning. How's everybody today? Great. Very good. Got a little bit of housekeeping to do here with the computer, and I'll be right back. Gertrude, for that very, I think, undeserved introduction, but thank you very much. I have been with Sodexo for a long time, and have quite frankly enjoyed working for the company. It's given me the opportunity to do a lot of things, like this, for instance. I've had the opportunity to be here in the Rhode Island community for about 12 years now, and every now and again I'll get a call from Jim Vincent or somebody else to come and say a few words, and I'm always happy to do it. So thank you for having me here today, and I do appreciate it. I do have to say I came in and I had on a tie, but this young lady over here told me that I had to take it off. Is that right?
He asked information, and I
did. She gave it. So thanks. If I look a little different now, that's the reason why. So really what I'd like to do today is just to have an opportunity to talk to you about a few things. Now, Obviously, health and wellness is a very broad topic, and there are so many things that you can talk about. And I really just tried to narrow a few things down and to try to help point people into the direction of resources that will be helpful for them in making decisions. So that's sort of how I focused through the presentation today. And hopefully it will be valuable to you. So let me get started. All right. So I am thrilled and honored really to be here with you today. And I was very surprised when Jim called. And I figured that whoever you invited before me probably told you no. And that might be the reason why I'm here today. But that's perfectly okay. When Julius asked me to present, he asked me to focus on a discussion about wellness and health in the community and how people can take action to improve their own health and wellness. So I thought, I did some research, and I said, you know, being of African American descent, my ancestors have been here for hundreds of years. And I think most people know the lineage of the majority of the African Americans who've been in this country for a long time. I'm very familiar with a lot of the health challenges, and you know, from in the community. And you know, there's a lot of incidences of high blood pressure, diabetes, sickle cell anemia, obesity are really big issues in the African American community. And I was really interested to learn through my research that health issues among African immigrants really is a little different, and it's unique. It's got some nuances to it that I was really interested to learn about. There's actually a lower incidence of obesity and diabetes, and a higher incidence of some other things, access to health care, and vision health, dental health, and some other things like that. And it really got me to think about, you know, what I don't know. Gertrude had mentioned that some of my experience with my company really was around some of our diversity efforts, and I spent a year as, really 2 years as a chair of our African American leadership group within Sodexo. About 700 managers and leaders within Sodexo that focus on broadening our whole company's ideas and knowledge about the African American community. Now, in the African American community is the African community, and we two are linked very, very closely. We're one. And, you know, so I did have a lot of sort of knowledge about that before I started, but I really needed to do more research, and I did. So I got that information. So based on that, I really want to talk to you today about making good decisions, about what you can do with your body that will impact all of these things that you see that I just talked about, and as well as you know, regular access to preventative care and some of the other challenges that are out there in the community. So right now, there's just so much focus on health and wellness these days, it can really get confusing. So I hope that these hopefully simple things that I share with you today will leave you with what I call work. There we go. With the power to choose. Okay? Because really, it is you that has the power. Right? And what I call this is really it's the power to learn, the power to eat, and the power to move. And to choose to do all three of these things. Right? So what does choose to learn mean? It means choose to understand that today you may not know some of the important information about health and wellness that you need to know to keep you healthy throughout your life. Knowledge is power, and by learning, you empower yourself that the choices you make about your own wellness are important. Whether it is food you eat, the beverages you drink, or the types of activities that can make a difference. The pace of information moves so fast, it is really hard to keep up. The key to staying informed is to find sources that you can trust to stay informed. And for many years, people have trusted many sources, television and you know, people that they trust and so forth. But I really think a great source is the healthcare community, and I know that they're represented here today. We've got a number of folks here today, as well as I know Blue Cross is here. I know Neighborhood Health Plan here is a sponsor as well as this event. These are really great resources and places to go to learn, to ask questions and to learn about health and wellness. I do have a brief story. This is from my own experience. That I was a doctor. This is probably going back about 4 or 5 years. And I have my doctor happens to like to make impressions and tell jokes. So So that's usually my experience. He tries to make, tries to make me laugh whenever I go in there. And I was in his office one day, and I was, sitting on the little bed with the paper, sit on the paper and it was a checkup. So they take all your clothes off and put on this, a really nice paper vest or whatever they call that thing. And I was sitting, with all the drafts sitting on the table, and I heard the door open. I turned, and it wasn't my door; it was actually the door of the room next door. And the doctor walked in. Now, I guess the walls of my doctor's office are pretty thin because I heard most of the conversation. And it went something like this. Hi, Mr. Smith. How are you today? I'm fine. Great. Well, last time you were in the office here, we talked about you, trying to eat better and trying to lose some weight. How's that going? Mr. Smith said, well, I'm trying to eat more healthy food, and, I try to do a little exercise when I can. And I heard the doctor says, all right, cut it out. Listen, I'm looking at your test results here, and I know that you haven't been doing any of that stuff. So let's stop pretending. The only person that has the ability to make a difference in your life is you. I can tell you whatever it is, whatever I can, but you're the one that has to make that choice. And really, I kind of took from that it's very, very important that we take the time to make that choice. And it's only you that can do that. So that's why I say it's the power. You have to make the power to choose. And the first point is to choose to learn things that are going to make a difference in your life. All right? So learning is just so important because if you stop paying attention to these things at any one point, you're going to wind up with sort of some outdated information. So, for instance, remember when cigarettes were considered healthy? Anyone remember that back in the day? All right. Not in my lifetime. Ever since I was a little kid, schools would always tell me, and every public health or PR spot on television would have talked about how smoking is bad for you and the things that it can do. But back in the day, it was a little different. I'm going to share with you a little clip from YouTube. As long as our technology wants to cooperate.
Find yourself having a mighty busy time keeping up with it. Time out for many men of medicine usually means just long enough to enjoy a cigarette. And because they know what a pleasure it is to smoke a mild, good-tasting cigarette, they're particular about the brand they choose. In a repeated national survey, doctors in all branches of medicine, doctors in all parts of the country were asked, what cigarette do you smoke, doctor? Once again, the brand named most was Camel. Yes, according to this repeated nationwide survey, more doctors smoke Camels than any other cigarette. Why not change to Camels for the next 30 days and see what a difference it makes in your smoking enjoyment? See how Camels agree with your throat. See how mild and good-tasting a cigarette can be.
Okay. Now, I guess it never actually said cigarettes are healthy, right? But it certainly did. It certainly gave you the implication that it was. So, if at that point you would sort of stop paying attention about what was healthy and what wasn't, you could be left behind a little bit, right? So that is kind of the point. You really want to just stay up on one. But there's just all kinds of ideas and thoughts. There's so many of them. Some of them conflict. They get a little confusing. Thank you, Mark. That it's really important to make sure that you stay connected. The next point was to choose to eat. Okay. You are what you eat. Garbage in, garbage out. An apple a day keeps the doctor away, right? Well, some of these are long-term thoughts that people have about a lot of things, and nutrition is definitely one of them. These are the phrases that I've heard for many years, and their implication is that the quality of what we consume will equal the performance we can expect from our bodies. Research tells us our physical and mental abilities are greatly influenced by the quality of food we eat. Did you know that some foods have a similar effect on the human brain as illegal drugs? Anyone heard that before? It's true that items with high amounts of sugar and fat can activate the pleasure centers of your brain, which makes you remember how good it was and want to do it again. Is it any wonder why it's so hard to break some eating habits? I know I struggle with Girl Scout cookies. I just cannot get enough of those peanut butter. You know the ones that are covered with chocolate? Get it. Coconut. All right. Coconut. I like it too. Okay. So I'm going to share with you another quick clip from YouTube. I've got to monkey with this one a little bit to get it to work.
Why are we eating more? What happened to make us eat more? We had this exquisite system, very sensitive system called leptin, that allowed us to modulate our total food intake for 50,000 years or more. And then all of a sudden, in 30 years, the thing is broken, seemingly beyond repair. How can we eat more than we're supposed to? And the answer lies in understanding the biochemistry of the brain. Because clearly those signals are not working. So, one signal is the starvation signal, which clearly is not working. And that's leptin. And leptin tells your brain you've had enough and you can burn energy properly. But when you don't get the leptin signal, your brain thinks it's starving. The second way is in the reward system. So there's an area of the brain called the reward system. The scientific name is the nucleus accumbens. And it is the site where dopamine works. Dopamine is a neurotransmitter. And it conveys the feeling of pleasure. And pleasure, for lack of a better word, is good. Except that a lot of pleasure, as it turns out, is not. In the process of going for more pleasure, we have changed our dopamine system. And one of the keys to addiction is the idea that after stimulating that system chronically, again and again and again, and it takes 3 weeks to do this, what happens is that the receptors for the dopamine signal now downregulate. Now there are fewer of them.
We know that the brains of people with obesity do respond differently to food. In that reward center, when they see palatable food, some parts of the brain light up a lot, that wanting part. But the liking part, once they taste the food, it's blunted. It's not that they're getting more pleasure and reward, they're getting less. That's like living with an urge that you can't satisfy. And so people think that this hyper-reward condition or this inability to experience the same level of reward from the same foods that other people are getting is causing people to overeat in order to get that dopamine that they're missing.
You have to eat more to get the same effect. And that phenomenon is called tolerance. And then when you pull the chemicals that cause the pleasure away, now there's no dopamine and fewer receptors, and that gives you symptoms of withdrawal. So tolerance and withdrawal are the hallmarks of addiction. We know that this occurs with nicotine. That's why we have tobacco addiction. We know this occurs with alcohol. We know this occurs with cocaine, morphine, cannabis. It occurs with every single drug abuse. And it occurs with sugar too. And that's relatively new data. that has come out in, say, the last 5 years.
Interesting, huh? So, a lot of technical terms in there, but basically what it says is that sugar makes you feel good, you want to do it again. And it continues to do. So I want to share with you one quick tip. And I actually use this with my kids, because I've got a son who's 13 years old, and he loves sugar. He loves sugar in every form. He loves sugar in bread, he loves sugar in soda, he just loves cookies. He loves it. So I did a little activity with him. I'm going to share that with you now. I've got a bunch of bottles and what I've done is I've measured out, based on the labels, I've measured out the amount of sugar. And I put the sugar in to the bottle. So I'm going to pass them around so you can see. Pass these over. Now, just about every one of those bottles I bought at Walmart over on Silver Spring, because it's right next to my office. So I just took a walk over and I bought it. The one that's in the clear cup, that is actually, I went online and I checked out Dunkin' Donuts website. They have something that I absolutely love called the Vanilla Bean Colada. I love it. A medium Vanilla Bean Colada has 32 teaspoons of sugar in it. 32 teaspoons of sugar. That's amazing, isn't it? It tastes so good, though. Now, I don't intend to give up my Girl Scout cookies, but I am going to moderate that. I hold in my hand, this is called a, what is this? Fruit 2-0. This is a sweetened drink. It's got natural raspberry flavor in it, water. It does have a little bit of artificial sweetener. And depending on where you stand on artificial sweetener, you might like it, you might not. But this has 0 sugar in it. I'm not advocating for that product. I'm just saying that there are choices out there that you can make that will make you, that will deliver the same satisfaction, refreshment to you, and be better for your body. This is the number one. Now, I don't know where you stand on bottled water. A lot of people don't like bottles for environmental impact. And I have my own father who tells me often he will never pay for water. He's never going to buy water. But water in whatever form, out of the tap or out of the bottle or however. So I'm going to tell you another little story, you know, because it talks about living with an urge. And this is another personal story from when I was a teenager. I had a friend whose father would drink a dozen Pepsis a day. And I make the Pepsis with, you know, with the full sugar. About 60, 65 grams of sugar in a Pepsi, which, by the way, is about 17 teaspoons. And he would drink 12 of those a day. And, you know, he would get really angry with my friend or his brothers and sisters if he thought someone was taking a Pepsi from the refrigerator. He'd get very upset. And I remember I was over at his house one day, and he actually threatened me that I would not be allowed back in the house if I ever took a Pepsi from the refrigerator, because those were his Pepsis. And they were for him and no one else. And I really thought that was strange. And I remembered that when I first learned about what this gentleman on the screen from the University of California had mentioned about being addicted to certain things. And he clearly was, now that I look back on it, because he a dozen Pepsis a day. That's a lot of sugar to drink on a daily basis. It's really amazing. So the reason I'm doing this activity is to share with you that drinking that much sugar on a regular basis can add hundreds of calories a day, which can become weight over the course of time. It is estimated that one soda with about 45 grams of sugar, which is less than that Coca-Cola that's out there, will add about 250 calories a day to your diet And over the course of a year, if you drink one a day, that's about 36 pounds of sugar. That sugar can potentially add up to 15 pounds of weight on a human body. Now these figures might be a little higher or lower, it really depends on what source you get them from, but I just wanted to make sure that I kind of illustrated that point for you. But imagine that, 36 pounds of sugar. I do have to say that I don't want to pick on Coca-Cola. Coca-Cola has been a good company for diversity and various other things. And they do have products out there that are products that you can build into a healthy lifestyle. And a Coca-Cola every now and again, or Pepsi, or whatever, or Mountain Dew, my son loves Mountain Dew, is not a bad thing, but in moderation. Okay? Now, I don't really mean to focus on sugar. I don't really mean to focus on sugar. There are other things in our diet that we can focus on, such as fats and sodium. But sugar is an area of concern for many reasons. One of them is diabetes. Now, you've heard people with diabetes, I've heard people for years. Before I even heard the word diabetes, my mom would tell me, oh, she's got sugar, or he's got sugar. And I didn't know what that meant. I was like, oh, can I have some sugar? I love sugar. When I was a little kid. Well, it turns out that's just a word that people use for diabetes. And drinking and eating so much sugar is a challenge. I have a rule in my house that I enforce with my kids as much as they eat it. Don't drink your calories. You're going to have calories, you're going to put calories in your body. Eat it. Don't drink it. That's hundreds of calories a day that you could be adding to your diet that you don't need to. Right. So, but knowing this information that I just shared is the way that you can make these important and critical choices. A few years ago, my father-in-law was diagnosed as pre-diabetic. And he reluctantly began going to a nutritionist to get advice about how he could slow or stop the progression of full diabetic diagnosis. After canceling his first few appointments, he didn't want to go. My mother-in-law really got on him and made him go. The next time I visited with him, I asked him about how his appointment went with his nutritionist. And he mentioned that he learned a lot about food that he never knew. This is a 65-year-old man at the time who said he learned a lot he never knew. And he was astonished because he asked me, for example, did you know that potatoes are sugar? He said, I always thought they were a vegetable. And I said, well, because of what I do for a living, I know that potatoes are starch. And that starch converts to sugar in the human body, and it has a very similar effect to any other kind of sugar. And as a matter of fact, his misconception is one that he said that he learned happens all the time to a lot of people. I said, that's very true. So I asked him, now that you know a few things about healthy diets that you didn't know before, are you going to change? And he sort of looked at me, gave me that sort of sideways look, and then he said, he'll eat less. He'll eat fewer potatoes. This is a guy who loves fried food. And, the bigger the portion of fried food on the plate, the happier he is. And, all of his favorite restaurants, when we go up to visit him, he lives in New Hampshire. Every time we go to visit him, we take him out and he goes to this restaurant called the Fisherman's Catch or something like that. And it is, he gets the platter of fried whatever and French fries. But he has moderated his diet. He has been able to avoid a full diabetes diagnosis. And he is doesn't need to take any meds, but that's only because he took the time to learn about what he was putting in his body and then made the choice to moderate it. So, I want to share with this slide with you, and I actually saw it there as well on one of our posters that says, this is actually from the USDA. This is something that we actually quite often use in school lunch, and as you know, one of my job is to feed school children on a daily basis. So this is really sort of the template, the model. If we had to break it down to a visual, what a healthy meal, a healthy plate would look like. If you notice that half of this plate is fruits and vegetables. And not just any kind of fruit and vegetable, but things that are nutrient dense, we call it. So dark green vegetables, and orange and red vegetables, things that are not just corny green beans. Surprisingly, we have a lot of starch in them. So we're doing other things. A lot of school kids here in Providence, actually, on a regular basis are enjoying bok choy and broccoli and various other things. We've done okra. We've done a number of things that are trying to help the kids learn about and be familiar with different kinds of fruits and vegetables that they can integrate into their diet for the rest of their lives. Grains and proteins are important parts of what your body needs, but not generally in the quantities that we typically consume. And of course, dairy is an important part of diets as well, in the forms of cheese and milk, etc. So these are all great things, and we generally eat them. We just need to change the balance of it. So ChooseMyPlate.gov is a great website that USDA has created to sort of provide some of this information. And I really think it's a great visual. I use it a lot because it really helps people understand. The final part is about making the choices, is to choose to move. Exercise is the foundation of youth. That is, the fountain of youth, rather. That is what my former boss said. He was a former NFL player in the 1970s, and it stayed in shape his entire life. He gave us that advice at a group dinner when we were having a go-away party for him as he was leaving the company to take another job. Now this was years ago, but I never forgot that advice because I found it to be very true. Your body needs the activity in order to function at its optimum level. Muscles in your body thrive on activity. They grow and change when they are used or shrink when they are not. Exercise muscles perform better and use more energy more efficiently. That's absolutely right. The healthy body actively burns more calories than one that is not exercised, even when the active body is at rest. The true challenge is that the less you move, the less likely you are to move. Unused muscles lose their strength and flexibility and then are used less. The less often muscles are used, the harder it is to use them. The harder it is to use them, the more likely it is they won't be used. You can see it truly becomes a catch-22. This is where a very critical decision is made. Exercising is hard, especially when you are trying to establish a new habit. If you have ever tried and failed, you'll understand. New Year's resolutions. Happens to me every year. However, only you can make the decision to take the step and exercise. Now, there's all different kinds. I myself, I'm a jogger, I'm a runner. And for many years, I have been a runner. I started in college, I was on the track team. And then after leaving college, I realized that I didn't really have anything else to do, so I kept running. Started just 10 or 15 minutes a few times a week and so forth. And over the years, I've increased that activity to the point now where I actually do, I run a couple of half marathons and I did about 5 marathons. Actually, the one here 2 weeks ago I did, which was crazy. Don't ever do a marathon. Really shouldn't. Gym memberships, exercise videos, exercise equipment, they're all options. These are things, but not all of them are necessary. A good start is just old-fashioned walking. That can make a big difference in a lot of people's lives as well. The key is to make the choice to get active and stay active. In summary, be open to learn about what people are saying about new ideas and thoughts in health and wellness. Today's information will include more and different research and facts than have ever been around before and will continue to change. When you are presented with choices about what you can eat and drink, consider your overall intake. It's fine to enjoy snacks and treats, but they should not be a large part of your diet. The majority of your food consumption should be fruits and vegetables, along with grains, meats, and dairy. The chart I showed earlier is a great guide. Think of it when you are making your food decisions. And finally, make the choice to exercise. It's really is the foundation. Staying active will extend your life and the quality of your life. These 3 things together will, with advice and guidance from quality people and organizations, such as the ones here today, will all that information and decisions will work together to keep you healthy and more able to lead a long and healthy life. here are 3 points, and I'll say that that's what I have today, and I'd be happy to open up and have some questions. If there are any.
And under the, 2 things, under the choose to eat, in your research in the African immigrant community, did you find a high rate of malnutrition as part of dietary issues? And then under the choose to move, I'm just gonna make a statement, choose a broom, choose a mop, choose a chore. It has to be done good.
Well, any kind of activity is good. And I know that the first point you made about malnutrition, I did find some incidents of that. I actually found a lot of studies from different cities. It was a big one from Minneapolis that I looked at. It did talk about that, but then it also talked about when people, recent immigrants anyway, when they would come over, the choices are so overwhelming here that, in the advertising and people telling you things. Remember when Kentucky Fried Chicken advertised that it was healthy? Now, I love Kentucky Fried Chicken, but I just kind of shook my head. I looked at my wife and I said, first of all, how are 2 pieces of chicken that you're going to use as bread with more meat in the middle? How's that healthy? You don't understand. But they did advertise it as healthy for a short period of time until everybody laughed that commercial off the air. So it was that kind of thing that seemed to be a challenge. It was making that conversion and from sort of one diet until trying to make good choices in.
Right. I mean, I lived in Botswana for 6 years, and when you go to the bread aisle, you have 2 choices, white bread and brown bread.
Right.
Maybe yellow raisin bread. This Wex market. You got 2 choices. You come here, you spend all day, what's the next question?
Yeah, that's true. There's a lot of choices to make. That's why the education piece is so very important. All right. Yes?
I think also in a lot of the places where people live, the communities, it's difficult to find fresh food, fresh vegetables.
Yes, it is.
Can you address that?
I absolutely can. Actually, there's a term out there that we use, that we've been using for a few years, called food deserts.
Yeah.
You may have heard of this. Basically, what that means is that there are pockets of very well-populated areas that don't have access to what you call fresh fruits and vegetables, or whole food, or not the market, but the concept of good, healthy food anywhere near. You may have to take a bus to a subway in some communities to get it. That is a big issue, and I know that that's part of the USDA has been addressing some of those things, setting up farmers markets in places, etc. that have been some of the solutions that they've come about. But it is a big issue, because if all you have access to are fast food restaurants, that's all that's around you, that's where you're going to go. And that's what you're going to be able to find. So that is a huge issue. I'm certain that there are places here, even in this city, where you don't have access, if you don't have a vehicle or transportation, it makes it very, very difficult to get to a place where you can get food that would be considered healthy or fresh. So that is a huge issue. I believe that there's been a lot of discussion here, and I know Jorge and I have had some discussion with our folks, and we've done some sponsoring of things, and we're talking about farmers markets and stuff on weekends to try to help with that same issue. But that is a very big issue in a lot of communities all around the country.
I don't have a question, just follow up on what you asked. One of the workshops today is, do you know where the food you eat comes from? So there's a further opportunity to have a conversation around that today. Okay.
Hi.
What's the is now with farmers essentially expensive? What can we do to make it affordable so that everybody can be able to go and maybe purchase their fruits and vegetables in the community?
I'll repeat the question, make sure I got it right. The question is that a lot of fruits and vegetables, farmers markets, and these sort of alternative places to get food can be expensive. Yes. And what are some decisions that can be made to do that? My advice would be to kind of understand what your goal is and what when you're creating your diet, because there were always alternatives to different kinds of foods. Like for instance, there's apple juice instead of apples, if you buy the right one, the right apple juice, the one without all the added sugar. But there are choices, there are options that you can make that might be less expensive. But generally speaking, I deal with food on a daily basis. I feed kids between here and the Midwest, and I understand about the cost of food because it's something I deal with on a daily basis. And quite honestly, a few years ago, when my kids were small, we made a decision that we would do more of our shopping, buying fresh food. And yeah, it was more expensive. And we had to make some decisions about what we could and couldn't, and what we were going to do and what we weren't, in order to be able to fit it into the budget. So we cut down on a lot of the refined grains and snacks and potato chips and stuff like that, and increased the fresh fruits and vegetables that our kids would have. And then we also try to utilize it better because, when you got little kids around the house, you throw out a lot of food. At least this has been my experience. So we try to do things like put out plates of cut up melon and that sort of stuff in enough portions that when the kids would walk by, they would take a piece when they were off to wherever they were going, walking through the house. So that we ended up finding that we were going through less food because instead of having, getting a snack and filling a bowl with a snack and eating half of it, they would just sort of take it as they went by, and that would keep them full so that they weren't looking for a snack every 2 hours or whatever, and then eating half of that snack and throwing it out. So there's just sort of some of the things, the strategies that we tried, and that I tried to manage that cost issue.
I just wanted to, my name is Ana Nuvaja with the Health Department. For folks who are in the WIC program, they do provide vouchers, checks to go to the farmers market. And because we know they are more expensive, but they are to be used only at the farmers markets, it's a way of promoting healthy foods and vegetables where you live and without the extra cost to the family. So if you don't have them, or if you do not know, just make sure that you add a week first.
And also your food stamps are usable as a part
of the same thing. And also there are community guidelines that are being developed in communities, and it's something that you can work on and that you could really be part of and help produce things that you grow yourself and that you can then and you have all the brochures in here.
Young lady over here.
Do you have workshop series for parents to educate them about the different food choices? Maybe through Sodexo, because I know you say you offer like bok choy and all those different things. To the students, that I can imagine going home to the parent and saying, oh, I had this, and the parent's like, okay, we're eating rice tonight. Because that's what they're used to. Even as an adult, to get my parents to, not eat fufu every day, not eat rice every day. It's very hard because that's what they're used to. And they're like, in Africa, we didn't get sick from the food. We were fine. But trying to get them to understand that in America it's different, and the food might be processed and, not organic than it was back home. But if you have an education series for parents.
From time to time we do that. We also actually are taking the step now we have a website called SodexoRI.com that we set up that highlights not only Providence but also a lot of the communities that we serve. There are 11 other communities that we serve here in Rhode Island. And we see ourselves as having the opportunity to provide resources. So we're in the process, actually this summer, we're producing a number of 3 and 4 minute videos that talk about that very same thing. And say, here are some healthy things to have in your pantry at home that are staples. So in a pinch, if you need to make something quick, instead of ordering a pizza, you can use these items. And here's some guidance like that. And we've done some things called quick and healthy meals and so forth. But we really sort of look at that as ourselves as trying to be able to be a resource for people. So I think really into the fall, we're going to have that, and it's going to be more on demand for folks. And then for folks that, I know that not everybody has computers and internet, that we actually have talked about doing some things. You can always talk to, in the communities we serve, you can always talk to the people who are the food service people for the schools, because we really see ourselves as food service people for the community. And, we have Ask a Dietitian on our website. We have an Ask a Dietitian link. We can set up appointments with our dietitians. People can meet and talk about these kinds of things as well. So the resources are out there. I know that folks in the Department of Health just gave some great information And the resources are out there, but the key is, like you guys are doing, you're here today, and it's amazing the power that you can generate when you get people in the room and you speak about the resources and things that are available. It's really great. Now, I know I have gone over my time, so I apologize for that. I'll get you back on schedule, and I will say thank you very much for the opportunity. I really enjoyed it.
How's everybody doing?
Very well.
Why don't we stand up for a minute? Move it, move energy moving. Yeah? Stand up. You know where shake your hands. Okay, everybody. Now you can sit back down, please. Perfect. Okay, we're running a little behind, so I'd like to tell you how we're going to modify our schedule a little bit. Can you hear me? Okay, first I'd like to remind everybody about our raffles. Has everybody? Hello? Hello? Come back to me. Come back. Okay, good. So you needed to get that energy out, didn't you? Yes. Yeah, you did. I know, that's good. That's good. CVS right gift cards, $25 gift cards. We have 9 of them. Thank you, CVS. And then we have 2 $50 gift cards. So again, right, get your raffle tickets. Walmart, $50 gift card. 4 right baskets. Thank you, Lifespan. 4 right baskets from Blue Cross Blue Shield. 2 right baskets from the community health centers. And we again, right, we'll be raffling those off after lunch, or maybe even during lunch. So, without further ado, I'd like to bring up our next right speaker. Maybe I should come out here and join you, do like Oprah does, right? So I'm going to have to modify the time based on us right being around 25 minutes over half an hour. So our next right speaker talking about healthcare reform, she'll come on now and go right for about 25 minutes from 11 to 11:25 on healthcare reform. And then our workshops will be from 11:30 until 12:40, and then we'll come back up for lunch. Okay, you guys notice? Great. Yeah, that's great. Thanks, Jimmy. So, right, Linda Katz is here, right, to talk about, where's Linda again? Okay, I was like, she's repeating one. To talk about healthcare reform, and as we know, healthcare reform is being sold as something that is going to benefit our community. There are lots of things right in healthcare reform that might not benefit our community. So we're really happy to have someone come down to our community, into our community to give us the real information about healthcare reform. So I present to you Linda Katz.
Good morning, everybody. Good morning. So I was going to start with what Gertrude just did, which was to ask people to stand, but we've already done that, so hopefully you're focused. My name is Linda Katz. I'm the policy director at the Economic Progress Institute. For those of you who don't know us, we do advocacy work on behalf of low and moderate income people in our state. We provide help explaining to people how they can access different public benefits, child care. We work on welfare reform. We also do a lot of work on tax and budget issues. So you could always check out our website, economicprogressri.org. We have a guide there where you can find out eligibility for different benefits and a lot about what's happening in the public policy arena in our state. We also have a new health coverage project. How many people have heard about the health insurance exchange? Okay. How many people have heard about the Affordable Care Act? Right? So the Affordable Care Act was the major health care reform that Congress passed 2 years ago under the leadership of President Obama. And I'm going to talk a little bit about what that's going to do in terms of helping people to access more affordable health insurance. And the Healthcare Reform Act has a lot of parts to it. It's going to hopefully provide more primary care, turn around our healthcare system so that people can go to doctors more easily instead of needing to go to emergency rooms for their health care because they don't have insurance. And I'll just say that I have handouts that are on the back table that include all of the information that I'm going to talk to you about this morning. But let's talk about first, in order to understand what healthcare reform is going to do, we have to talk about how people get health insurance now. Okay? So what do you think is the primary way that most people in our state have health insurance? Through their employer.
Right care.
Right. Okay, so let's talk the employer and right care. So most people have health insurance coverage through their employer, and that's not going to change. What is going to change is that sometimes people can't afford the insurance through their employer, and the Healthcare Reform Act says that if you can't afford insurance through your employer, you're going to be able to buy it through this thing called the exchange, and I'll talk a little bit more about that. The other thing that Dr. Simon just said is right care. So how many people know what the right care program is? You don't see NHP in the health center raise their hand. So right care is the program that we have now. It's a Medicaid program that provides health insurance coverage, either free or low cost, to children, to pregnant women, and to parents who are living with their kids. And there are two sort of tests to see who's eligible for the right care program. One is the family's income below the limit, right? But we have pretty high eligibility limits for the right care program. So if you're a parent with kids under the age of 18, your kids are eligible for health insurance coverage through the state if your family income is less than $48,000 a year. That's close to half of the average wage in Rhode Island. So a lot of families in Rhode Island should be eligible for right care coverage based on income. The eligibility for the parent is a little bit lower. It's only $33,000 a year. And that's an example for a family of 3. And you'll see in the back there's some more information about the income limits for the right care program. A catch, though, is the second test for eligibility for right care, which is that you have to be a citizen or eligible immigrant. And eligible immigrant means people who are refugees are eligible for coverage. People who have a green card, who are lawful permanent residents, are eligible. However, parents are not eligible if they have a green card until they've had that status for 5 years. So a family that was sponsored here who has a green card, the kids are eligible right away if their family's income is below the limit, but the parents have to wait for 5 years. Also, kids are eligible as long as they're lawfully here. So undocumented children, not eligible, but if they have any lawful status, so folks from Liberia who have the temporary protected status or deferred enforced departure, those kids are eligible for coverage. So any legally present child, eligible for coverage. For parents, a little bit more limited. Only certain categories of immigrant status are eligible for right care coverage. So lawful permanent resident, as I mentioned, but waiting 5 years before eligibility. Pregnant women are eligible for coverage regardless of their status. So a pregnant woman who's undocumented is eligible for coverage, as well as a pregnant woman who's a citizen or has any immigration papers. Also, besides right coverage for people who are elderly, age 65 or older, or people who are disabled. And the income limit is lower, and also the eligibility, if you're not a citizen, only certain categories of immigrants are eligible. So if we're covering now through TRICARE or medical assistance, children, parents, pregnant women, people who are elderly, people who are disabled, what's the one category of people who are not eligible?
Single.
Single, non-disabled, non-elderly, non-pregnant adults, right? So one of the big things about healthcare reform is that that's going to change in January of 2014. Beginning in January 2014, adults who don't have kids in their care are going to be eligible for medical assistance. And the income limit is going to be around $15,000 a year. Right? So right now, if you want to walk through the state Medicaid door, you have to be pregnant, a kid, a parent, elderly or disabled. And if you're a single adult, the door is closed to you. In 2014, that door opens, and as long as your income is less than that $15,000 as a single adult, you'll be able to get health insurance coverage through the state. And that's a huge change for our country because it's going to set a level that everybody, if their income is low enough, is going to be eligible for some health insurance coverage. But the catch, when I say everybody, do we ever mean everybody? When we say everybody? No, right? We mean citizens, and we mean immigrants who are lawfully here. And unfortunately, although there was a lot of advocacy to try to change that rule that said if you have a green card, you can't be eligible until you've been here for 5 years. The folks who advocated to eliminate that 5-year waiting period were not successful. So unfortunately, even when that door opens to single adults in 2014, if you have a green card, you still have to wait for 5 years before you can come onto the medical assistance program. Right? But again, on the one hand, huge change to say that everybody who has income below a certain level is going to be eligible for our federal and state-sponsored health insurance, something we've never had before in our country. But we still have a lot of advocacy work to do to make sure that there's some equity for people who are not citizens. The second thing that the healthcare reform does that's going to help people is that if your income is too high to get the new medical assistance coverage, then people are going to be able to buy commercial coverage like Blue Cross or United through this new health insurance exchange that's going to be set up. And people who have income less than 4 times the poverty level, so for a single person, that's going to be about $36,000 a year. If you have income less than 4 times the poverty level, you'll be able to get help paying for your health insurance. And it's going to work through this sort of complicated system of getting a tax credit, but that coverage will be available also to legal permanent residents who are in that 5-year waiting period. The question will be how affordable that's going to be to people to buy into a Blue Cross coverage or a United coverage, or Tufts health insurance coverage might participate as well. But that new system of healthcare reform, again, this is all going to start in January of 2014, is going to, again, open up the doors to people who are low income, as long as they're citizens, lawful residents, and then for people whose income is too high for that basic coverage, the federal and state coverage, it's going to say you can buy a product with the health insurance exchange, and you'll get a subsidy, you'll get help being able to pay for health insurance coverage. That health insurance exchange for people will also be a place that if you've ever tried to buy health insurance now, or if you have coverage through your employer, I know for me, when I don't really understand how my health insurance coverage works that my employer gives me, whether I have to, when do I have to pay out of pocket? When are visits free for me? How much do I have to pay before the health insurance kicks in? You'll be able to see much more of that information on this new website that the exchange is going to set up. So we'll all be able to be better health care consumers by using this new health insurance exchange. Okay? So what about people who are not going to be eligible, are not eligible now for health insurance through RightCare, right? People who have to, legal permanent residents who have to wait 5 years before they can get a RightCare card, or people who are undocumented and will never be able to get coverage. Where do people go for care now if they don't have a health insurance card? Yes? I'm sorry, say again? To the health center?
For care most of the time.
Yep.
Just they can afford to go to a clinic, they go to the clinic.
And why can't they afford to go to the clinic?
Because they don't have.
Because the clinic charges.
They can't afford to.
Okay. So the networks of community health centers, and we have the Providence Community Health Center here today, is the place that people are supposed to be able to go for care. There is a sliding scale for that. And I think if there's concerns about even the sliding scale being unaffordable to people, that's a good issue to raise with the community health center. To say, you know, we have people who just can't afford even the $10 to be able to come here. What can we do about it? The health center has a board of directors. They could hear some of those issues and figure out whether there's a solution.
There is also a law that requires the hospitals to provide care, and that people know about that. The Department of Health does have publications in many statistics, I think, that indicate what the intake is, so that there really should be no reason why someone should not go to the doctor because of cost.
Right, that's a really good point. So let me, and there is more information in one of the handouts about if you go to the hospital and you don't have insurance. You're absolutely right that all the hospitals are required under the rules that the Department of Health puts out to provide what's called charity care. So it's free care or reduced price care depending on income. And that's for outpatient services as well as if you wind up an inpatient in the hospital. People, they don't ask about, and I see Dr. Fine, the director of the Department of Health here. The hospital charity care applications do not ask about citizenship or immigration status. Used to be a couple of years ago that I know one of the hospitals was not providing free care to people who were undocumented. If anybody experiences something like that, they should call the Department of Health and complain about that, because that free care is available to all Rhode Island residents regardless of status. There are also, in addition to the community health centers, 2 free clinics in Rhode Island, and I don't know if folks are familiar with those. One is the Rhode Island Free Clinic that serves only adults, and again, they don't ask about your immigration status. It's available to anybody who lives in our state, and they have a lottery the first Thursday of every month at the clinic that's over on Broad Street, 655 Broad Street. So people can go there to get free care. They've really grown that clinic over time so that it's not just seeing a doctor, there's also medication available, and they can hook people up with specialists. And even after healthcare reform happens in January 2014, there will still be people who either can't afford coverage or are not eligible, and that free clinic and the community health centers are still going to be very important sources of care in our community. The second clinic is Clinica Esperanza, that's called Hope Clinic, and they serve both adults and children, and they're on Valley Street in Providence. And again, there's information in the handouts back there with contact information for the clinics. As I mentioned, we have this healthcare reform implementation project, a coverage project, where we're really trying to bring, as the state is making decisions about healthcare reform is going to happen, to make sure that your voices and our voices are heard by the state. We're going to be developing this whole new website where we're going to be able to go and enroll in Medicaid and enroll in that subsidy program that I mentioned, where we'll get help paying for health insurance coverage, and also be able to make get more information about health plans. So we want to make sure that as that's set up, it's something that we're all able to use easily. And if you want to get involved with our project or get information about that, there's a flyer on the back table for you to take, and we love to work with you. So that's sort of the gist. I know healthcare reform is huge. What I've talked about is really just the coverage part, and I guess the two takeaways are that adults without kids will be eligible for coverage for the first time. Unfortunately, we still, our country has not come to the point where we want to provide coverage to everybody, regardless of their status, and so there's still some restrictions if you're not a citizen about who can get that coverage, but we can keep working on that issue together. And then for people who aren't eligible for the medical coverage, the free or low-cost coverage, there'll be this new ability to buy commercial insurance, but there'll be a subsidy available to do that. There's a lot of little pieces to work on as this is moving out, but those are sort of the two big changes that are going to be happening under healthcare reform that will help people access health insurance. And I'd be happy to answer questions. Yeah?
What's the reason behind those who has green card to waiting for 5 years waiting period? What is the reason? Why are they doing that?
Well, the reason is that, unfortunately, back in 1996, under President Clinton, there was an overhaul of the welfare law, and there was an overhaul of eligibility for all the different public benefit programs, where conservative people wanted to stop, thought that too many people were coming from other countries to take advantage of our cash assistance program and medical coverage and SNAP food stamp benefits here. And so they said, we're going to set up this rule that says legal permanent residents can't get the benefits for 5 years. And that used to apply to kids as well, and there was then a lot of outcry about how that was unfair, so that's it. Congress changed the rule for children, but it was really just, I'll just say xenophobia and fear of other people coming in.
But they are paying taxes equally as Americans, so I don't think that is the right answer.
I agree 100%. And there's a lot of people who agree with that, and there, as I said, when healthcare reform was happening, there was a real push to try to lift that 5-year waiting period. But as you know, Congress is still pretty conservative, so they're really, we couldn't get that passed through Congress. Doesn't mean that people won't go back and still try to push for that, because it is a totally unfair limitation. It makes no sense at all. Any other questions about coverage now? Or what's going to happen?
Could you talk a little bit more about the formation of the exchange? You mentioned the names of 3 insurers. Neighborhood Health Plan is an insurance company, isn't it?
Yes, Neighborhood is an insurance company, but it doesn't sell commercial insurance.
Why is that?
They're not licensed to do that now, so they'll have to decide whether or not they want to change and be
so they have the option?
I think there's a lot of complicated issues around Neighborhood becoming a commercial insurer, which I'm not at all equipped to address. But it would be great if they did. Yeah.
I don't know whether this affects many people here, but currently one piece of the law that is in effect is where if a child is less than 26 years, they can be covered currently under their parents' insurance.
Yes, thank you. So the healthcare reform, the Affordable Care Act, has some rules that went into effect already. So thank you for raising this. So the question was, isn't it the case that now if you have health insurance, commercial health insurance, your children can stay on your health insurance until they turn age 26. And that is already in effect. That was part of the healthcare reform. And it's a really good protection because before, when kids reach the age of adulthood, the parents couldn't cover them anymore under their insurance, and it's very expensive to buy individual insurance. So now you can have family insurance that covers your kids until they turn 26. Very good for me since my daughter's turning 19 on Monday and otherwise would not have health insurance. Yes?
I think they have to be fully registered in the school.
In
They
school?
have to be fully registered.
No, that's not, no. That's one of the things that it's up to age 26 whether or not that young adult is in school. It used to be in Rhode Island that you could get coverage till 26 only if you were a full-time student. And because of the federal law, that student rule went away. So now it's opened it up, and any young adult up to age 26 can stay on their parents' insurance. There's also on the a program called the Pre-Existing Insurance Program, where if somebody is disabled and has been uninsured for 6 months and they haven't been able to buy insurance through Blue Cross because it's too expensive, there's now a new insurance product they can buy that's lower cost and that they can get even though they have a disability. And there's a number of people who've been able to take advantage of that coverage as well. And that's sort of a bridge until 2014 when more people will be eligible for affordable coverage and also be eligible for the Medicaid program. Other questions? Okay.